Assalamualaikum and good morning to one and all. Today we'll study about part 3 of Pharmacology of Local Anesthetics. I am Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to explain adverse effect of local anesthetics, discuss pharmacology of cocaine and procaine, discuss methods of administration of local anesthetics. So let's start with first part, that is adverse effect of local anesthetics. We know that local anesthetics, they are generally meant for local application and you don't want their systemic action. So if local anesthetics, they absorb into systemic circulation, they are coming into contact with different systems and organs and it may produce adverse effects. So let's see how local anesthetics, they produces the adverse drug reaction. So the toxicity or adverse effect of local anesthetics after topical application and regional injection. So topical application means just if you are applying local anesthetics in the form of the cream or ointment, or in case of regional injection it means if you want the anesthesia of particular part, then you are giving injection in that particular nerve or in that particular region. So when you are giving injection at particular region, that the region where you have given anesthetic agent, there it is expected that it produces the anesthesia. Now sometime, even though you have applied it topically or you have injected regionally, but this drug, it may goes into systemic circulation and it has ability to produce toxicity or it may produce adverse effects. Okay. So the toxicity after topical application and regional injection, it is depend on the relative rate of absorption and metabolism. So if there is more is the rate of absorption, that could be possible if local anesthetics having more lipophilicity. So we have seen there two groups are present in case of local anesthetics. One it is lipophilic group and second one it is hydrophilic group. So aromatic ring, it provides lipophilicity to the local anesthetics. Now if that lipophilicity, if it is more, then although you have applied topically, but through skin and into different membrane, it goes into blood circulation. Here also you may have given the injection at regional level. You have not given injection through the IV route, but still that particular drug from that particular region, it may absorb into systemic circulation. So first thing it is the absorption, and second thing it is also depending upon the metabolism. Suppose if drug, if it is quickly undergoing the process of metabolism, then obviously that drug it is going to be excreted also. But in case of the drug which having the rapid absorption, so there is the rapid absorption. So in case of highly lipidic drug, and those drugs which are slowly metabolized, so if metabolism, if it is slow and if they are rapidly absorbed, then such drugs are more toxic in nature and they has ability to produce more adverse effect or toxicity in case of local anesthetics. Okay, so this is about adverse effect of local anesthetics. So we have seen, so there are two important parameters it's play a role in case of toxicity. First one it is the rapid absorption and second one it is the slow process of the metabolism. So it is depending upon which local anesthetics you are using. If it is highly lipidic, then it will be rapidly absorbed and it may has the ability to produce systemic toxicity. Likewise, if the drug it is slowly metabolized, then it remains in unchanged form for more time and it may expose to the different part of the body and has ability to produce toxic effect. Okay, so these are two important parameters which decide whether local anesthetic it is going to produce adverse effect or not. Okay, let's move on to the various adverse effect of the local anesthetics and we'll see what are the different adverse effect that are causes due to administration or due to application of the local anesthetics. So first important thing it is depending upon the organ. So there are two major organs are affected. One it is central nervous system and second one it is cardiovascular system. So when we have studied pharmacology of local anesthetics on the CNS, we have seen that in CNS it produces the excitement and that is followed by depression of the central nervous system. So initially the local anesthetics produces the symptom of excitement and then it produces the depression. So if high dose of local anesthetics, if it reach the central nervous system, then depending upon dose, it may produce a symptom something like this. So first symptom could be the lightheadedness. So it depending upon concentration. For as you increase the concentration of the local anesthetics, it is going to show this different type of symptom. So suppose dose, if it is low, the patient may suffer from lightheadedness. Then if you increase little concentration, patient may suffer from dizziness. Then the patient may also suffer from auditory and visual disturbance. So auditory means it is going to affect your auditory nerve. The visual disturbance, it is going to affect your optic nerve, right? And due to that, there is problem in auditory function, that is the function which is related to hearing. You are not able to properly hear the thing. So there is auditory disturbance. And visual disturbance, you are not able to properly visualize the thing. You are not able to see the things in the way you see in case of normal condition. Okay, so there is auditory and visual disturbance. So these are the initial symptoms. Then patient may suffer from mental confusion and disorientation. So now you can see the symptom of CNS excitements are started, that is mental confusion and the disorientation. Then patient may show the shivering and twitching of the muscle. So this is also one of the symptom of excitement of the central nervous system. The patient may show involuntary movement. So it is due to excitement of your motor neuron, because the motor neurons and other neurons, it's responsible for the voluntary movement. But what is happening here? There is increase in involuntary movement. So it is not related to motor neuron. Please get corrected. It is not related to motor neuron. It is related to your autonomic nervous system. So involuntary movement, it is affected. Finally, the patient suffer from convulsion and respiratory arrest. So the symptoms till here, that is which are shown in the blue color, that is mental confusion, disorientation, shivering, twitching, involuntary movement and the convulsion, these are all symptoms of excessive CNS excitement. But do remember that there is certain capacity of your central nervous system also. So beyond that capacity, if there is more CNS excitement, then suddenly brain undergo the process of CNS depression, to the extent that the patient will suffer from respiratory arrest. So the respiratory arrest, it is happened due to excessive CNS depression, which affect your respiratory center in the brain. So for example, if you have an ability to lift the stone of particular weight, okay, so up to that ability you can lift it, and suppose if that weight, if it is increased, then you are not able to lift, it might possible that you may suffer from the problem related to muscles, or during the process of the lifting of very heavy weight of the stone, there could be the failure, isn't it? Likewise here exactly happen, as you increase the concentration of local anesthetics, initially the patient suffer from CNS stimulation, okay, and again for CNS stimulation there is limit. Since there is excessive CNS stimulation, suddenly patient suffer from CNS depression and he may suffer from respiratory arrest, that is the last point, and it may lead to the death of the patient as well, okay. Now suppose the patient was on treatment with the local anesthetics, and as an anesthetician or as a physician or as a pharmacist, if you are working in the hospital, you have seen that patient has started showing the symptom of CNS stimulation. It means the local anesthetics have reached to the central nervous system. Now at this moment, if you can stop those symptoms by giving some CNS depressant drug, like you can give the diazepam, so which is the benzodiazepine, then the CNS stimulation can be prevented. Okay, and if you can able to halt at the level of CNS stimulation, the patient will not suffer from respiratory arrest or very excessive CNS inhibition. Okay, so these are the adverse effects which are related to central nervous system, and we have seen how we can overcome it by giving diazepam as a CNS inhibitory drugs. But do remember that it should be given when patients suffer from CNS stimulation. Once patients suffer from respiratory arrest, and if you are giving diazepam, then the condition become very severe. So when to give and up to what dose it is to be given, it is completely need to be guessed based on the condition of the patient by the anesthetician. Okay, so this is the effect on the central nervous system. Let's see what is the effect on cardiovascular system. So we have seen in last lecture in the pharmacology of local anesthetics, most of these local anesthetics, they are cardiac depressant in nature. So they depress cardiovascular system. And due to depression of the cardiovascular system, the patient, if the drug, if it is reaching to the cardiovascular system or into the blood vessel, or maybe if it is reaching into the heart, then the patient starts showing the symptom which is related to depression of the CVS. For example, the patient may show the symptom like bradycardia, that is the slow heart rate or the slow heartbeat. Then he may suffer from hypotension because your drug, it is reducing the heart rate, it is reducing the cardiac output, and overall effect will be the hypotension. Okay, and there will be the drop of the blood pressure. And if it is not controlled at this level, suppose if the patient suffers from bradycardia, as anesthetician you have observed that, and if you are unable to control it at this level, then it may lead to severe vascular collapse and it may have very severe consequences in the patient. So this is the effect on the cardiovascular system. In addition to this, injection of local anesthetics, it may be painful, and we will see in case of the cocaine, the precaution must be taken. You are not giving injection. I will see that in detail why injection of cocaine should not be given. So injection of local anesthetic, it is the painful. So that is one more disadvantage or adverse effect of the local anesthetics. And if you want to add that is vasoconstrictor. We have seen in last lecture we used the adrenaline as a vasoconstrictor in order to get blood free area, in order to avoid more loss of the blood. Okay, so if you have added vasoconstrictor, then addition of the vasoconstrictor, it enhances the local tissue damage. So generally you want vasoconstrictor in order to get blood free area for proper minor procedure. Okay, but this vasoconstrictor, in case of some of the drug, it may lead to the local tissue damage because you are giving the injection of those local anesthetics. So these are the adverse effects which are seen in case of most of the local anesthetic drugs. There are some adverse effects like hypersensitivity reaction, which is not seen with all local anesthetic. So it is common only with few local anesthetics like ester-linked local anesthetics. They show hypersensitivity reaction. So we have seen there are two types of local anesthetic. One, it is the ester, and second one, it is the amide local anesthetics. So out of this, the ester-linked local anesthetics, they show the more hypersensitivity reaction. So let's see what are the symptoms related to hypersensitivity reaction which are seen in case of patient who is hypersensitive to the ester-linked local anesthetics. So the first symptom, it is the rashes. The rashes, it is related to the skin rashes. So it is one of the common allergic symptom. It may lead to the angioedema. So there is edema of the blood pressure. It is called as the angioedema. The patient may show the dermatitis, inflammation in the skin. Fourth one, he may suffer from the contact sensitization. What is contact sensitization? For example, if you have taken ester-linked drug, once and the moment you apply it at the part, suppose if you applied it topically, the place where it is applied, there you may suffer from the itching and the area become a red in color, right? And there is discomfort. So such condition, it is called as contact sensitization. Likewise, sometimes if it is goes into intravenous into the systemic circulation, then patient may also show the reaction related to bronchi. He may suffer from asthma, and rarely the patient also show the symptom of anaphylaxis. So anaphylaxis, it is the allergic reaction. So if you are exposed to the allergen, and suddenly if you are suffering from the contraction of your bronchi and there is breathing issue, right, and then such kind of condition, it is called as the anaphylaxis. So it is the acute disease. It is seen rarely, but sometimes it is seen in case of the ester-linked local anesthetics, in case of patients who are allergic to these drugs. But it is common with ester-linked local anesthetics. It is not with amide local anesthetics. Okay, so we have seen different adverse drug reaction which are related to local anesthetics. Let's move on to few of the local anesthetics we'll see in today's drug. I'm not going to cover every drug. We'll be saying some drug which having the unique property, or rest of the pharmacology it is same as other local anesthetics. And we already seen pharmacological action of the local anesthetics. We have also seen the pharmacokinetics. So there is no much difference. Wherever unique thing is there, so those local anesthetics we are going to cover in today's lecture. So first drug it is the cocaine. So cocaine it is a natural alkaloid. It means it is obtained from natural resources. Okay, so it is obtained from the leaves of Erythroxylon coca. So those who are preparing for GPAT point of view or GPAT examination, so this it is source is very important. So the cocaine it is natural alkaloid. It is obtained from the leaves of Erythroxylon coca. Okay. Second thing is that it is a good surface anesthetic. So that is the uniqueness about the cocaine. Once you apply it on the particular surface, that surface you will get very quick anesthesia. So it is very good surface anesthetics, and it can rapidly absorb from the buccal mucosal membrane. Now, when you are using anesthetic agent in the buccal mucosal membrane, obviously when you want to do minor process which is related to buccal cavity, or if you are dealing with the teeth or either teeth extraction or minor surgery related to teeth, then you need to apply local anesthetics in the buccal or mucosal membrane. So it can rapidly absorb from the buccal and the mucosal membrane. So it is a good surface anesthetics. But there is precaution with the cocaine. The cocaine cannot be used for the regional anesthesia. So when you are using regional anesthesia, and how you are doing that, it is when you are giving injection at particular area, that is called as regional anesthesia. Okay. So in case of cocaine, it should never be injected. So cannot be used for regional anesthesia. It can be only used as a surface anesthetic agent. Okay. So it should never be injected, because the cocaine it is the protoplasmic poison, means it has ability to produce damage to the cell, or it produces the death of the cell. Okay, so if you give injection of the cocaine, it may produce the death of the cell, and it may be so severe that the area where injected, there could be the possibility of tissue necrosis, so death of the tissue. So those part where the injection it is being given, at that area you may see the complete necrosis of the tissue. So this is the precaution that you need to exercise in case of the cocaine, and you must remember as a pharmacist, it should never be injected. Why? Because it is protoplasmic poison, produces the death of the cell, and in severe cases it is so severe that it causes tissue necrosis. Okay, so this is the unique property about the cocaine. Next thing is that it produces marked effect on the mood and behavior. And we know that the cocaine it is one of the drug of addict. So many addict patients they take cocaine. Why they are taking it? Because the mood and behavior it is affected by the cocaine. The patient feel the sense of well-being, right? No matter how much stress he has, how much poor he is, or how much problem he has, he forget it after taking the cocaine. So that is called as the sense of well-being. So he feel that I am the king of this world after taking the cocaine. So this is what in this common way I have tried to explain you, and that is the reason why people they take why the people they addicted towards the dose of the cocaine, because it produces very powerful sense of the well-being. Third important thing is that it increases the power of endurance. So power of endurance it is especially needed in case of either soldier, or it is needed in case of the athletes. So it is common that those soldier who was working in the war field for more than 12 hours, and if they are not able to take the rest, then in those cases it is legally the cocaine can be given to those soldiers so that their endurance can be increased. But it can be misused by the athletes to increase their power of maybe the running and other athletics work. So it is banned, especially in case of athletes, and many athletes has to undergo the test before they are selected for especially in case of the athletic competition. that where they have to prove that they are not drug addict, they are not taking the cocaine to increase their power of endurance. Okay, so these are the problem with the cocaine. It is also strong psychological, but it also produces strong psychological but little physical dependence. So the dependence which is produced by the cocaine and the addiction which is produced, it is basically due to strong psychological dependence. Okay, so there is very strong psychological dependence, and as a result of that, if patient doesn't get cocaine for more time, then there will be the very strong craving or the hunger for the cocaine, and that patient will not live without cocaine. Okay, so it produces strong psychological but little physical dependent, and it is unique among the drug of abuse, and that is the reason it is not available as a drug because it can be misused. Okay, and it not produce the significant tolerance. So it is unique among the drug abuse, so it is not commonly used local anesthetics in the medical practice due to its reason of it can be the misuse for as a drug abuse, or it can be misused by the athletes. Okay. Now let's see what are its effect on different center in the brain. The cocaine we have seen, since it influences CNS, it also influences different centers which are present in a brain. So one of the center, it is the vagal center, and vagal center it control especially your heartbeat. What cocaine it does, it affect the vagal center, and as a result of that, it produces the bradycardia. So the bradycardia that we see, it is not necessarily due to the direct action on the cardiovascular system, but it may also be due to the action through central nervous system. So through CNS, it affects vagal center, and as a result of that, it produces the bradycardia. In addition to this, it affects vasomotor center, and it produces the stimulation of vasomotor center. So vasomotor center, it is the center which control the diameter of the blood pressure, diameter of the blood vessel, and stimulation of vasomotor center, it lead to contraction of the blood vessel, whereas the inhibition, it lead to the dilatation. Now since it stimulates vasomotor center, it produces the contraction of the blood vessels, and it may lead to rise in a blood pressure. Obviously, when contraction is there, it increases the blood pressure in the patient. So stimulate vasomotor center and lead to rise in the blood pressure. It also stimulate vomiting center, and due to stimulation of vomiting center, patient may suffer from nausea as well as vomiting at excessive dose of the cocaine. It also stimulates temperature regulatory center, which control the temperature, and the stimulation of temperature regulatory center in the brain, it may lead to increase in the heat production. Right? So these are the different center which are influenced by the cocaine. So vagal center in stimulation lead to bradycardia, vasomotor center stimulation lead to rise in a BP, vomiting center stimulation lead to nausea and vomiting, and effect on temperature regulatory center lead to increase in the heat production. So these are the effect on the different center. Let's see what is its use. So generally cocaine, it is not widely used drug, but sometimes it is used as an ocular anesthesia in case of the eye, where there is very less possibility that the drug can absorb into systemic circulation, and it can produce all this effect on the CVS and the CNS. So only use it is mostly on in case of ocular anesthesia. So that is only the use of the cocaine. Let's go ahead and we'll see about second part, but before that we'll be having the small break for question and answer session. So my first question is, enlist few adverse effects of the local anesthetics. So we have seen different category of adverse effect of the local anesthetics. So you are requested to enlist the few of those adverse effects. So let's see who give the first answer. Okay, I'm waiting for your answer. Hope you all of you are active. Okay, Ikra Sheikh mentioned about twitching and convulsion. So you mentioned about first thing, it is CNS. So CNS in case of central nervous system produces twitching, convulsion, lightheadedness, dizziness. Okay, very good. So many of you are giving the answer. Okay, Ashi Malik mentioned about a convulsion. Zainab mentioned about respiratory collapse. Very good. Involuntary movement mentioned about the Roma. Nabira mentioned about twitching and involuntary movement. Okay. So rest are very common. Bubere Umema mentioned about mental confusion. So that was we have not seen. Shifa mentioned about auditory and visual disturbance. Okay. Sahir mentioned about the convulsion. Okay, so almost all the side effect that you have mentioned, it is related to central nervous system. In addition to CNS, it also produces adverse effect related to cardiovascular system. Anyone else know what are the effects on cardiovascular system? Very good. I can see the Naved has mentioned that it produces the hypotension. So hypotension, it is one of the adverse reaction on the cardiovascular system. Very nice. Zahid has mentioned about conversion. Okay, what else apart from hypotension? What else apart from hypotension, especially with reference to cardiovascular system? Bradycardia. Yes, Mithili mentioned about the bradycardia. So it produces the bradycardia. Okay. What is the adverse effect related to especially the Esterling local anesthetics? Okay, Namira mentioned about shivering. Yes, that we have not seen. Zainab mentioned about vascular collapse. Okay, so that is related to cardiovascular system. Involuntary movement. Okay. So good number of adverse effect we have covered which are related to local anesthetics. Let's move on to next question. What are the symptoms of hypersensitivity reaction which are associated with the local anesthetics? So symptom of hypersensitivity reaction which are associated with the local anesthetics. Okay, Mithili mentioned about the rashes, dermatitis. Yes. Patients suffer from rashes and dermatitis. Kajal mentioned about angioedema, that is inflammation of the blood vessels. Okay. What are the other hypersensitivity reactions? Symptom of hypersensitivity reaction. So rashes, angioedema are very common. What happen in case of very high dose? Someone mentioned about contact dermatitis. The patient suffer from dermatitis. Jihan mentioned about anaphylaxis. Yes. So that is very severe condition. Anaphylaxis, asthma. So suddenly Shifa mentioned about the asthma. Very good. Mohammad Aftab has also mentioned. Wonderful. So especially in case of hypersensitivity reaction, which is common with Esterling local anesthetic. So this is one of the point that you must remember as a pharmacist. And it is seen in case of the allergic patient. We have seen different hypersensitivity reaction symptom, right from the skin rashes, then dermatitis, the angioedema. The patient suffer from contact sensitization, anaphylaxis, and asthma. Okay, so these are all symptoms which are related to hypersensitivity reaction. Let's move on to third question. What precautions should be exercised with the cocaine as a local anesthetics? So now I am just talking about the cocaine. As a pharmacist, if you know this, then you can avoid it, especially in case of the hospital where if the cocaine, if at all, if it is used, although it is not widely used drug, but there are some countries where cocaine it can still be used as a local anesthetics. So what precaution should be exercised with the cocaine as a local anesthetics? So let's see who give first answer. The precaution to be exercised with the cocaine as a local anesthetics. Very good. So first answer given by Ghulam Ahmed. So it should not be injected. Okay, it should not be injected. It is one of the precaution. What happen if we give the injection of the cocaine? So that is the reason why we should not inject it. Okay. Shifa mentioned about injection causes protoplasmic poison. Yes, one of the reason it is protoplasmic poison. What could be another reason? What happened in case of the severe cases? Now this protoplasmic poison, it becomes severe and it may lead to some other problem as well. Okay. So Kajal mentioned about it should never be injected because it causes the tissue necrosis. So there are two reasons. So one thing is that it produces protoplasmic poison, produces damage to the cell, and in severe cases it is so severe that it may lead to tissue necrosis. So that is the reason, as a pharmacist, you always remember that injection of cocaine should not be given when you are using it as a local anesthetic. So for regional anesthesia, especially, you are not using cocaine. Generally you are using it as a topical anesthetic agent. So we have seen about the cocaine. Now let's move on to the second part of today's session. The second drug, that is the Procaine. So the Procaine, it is the first synthetic local anesthetics. Although it is first synthetic local anesthetics, but it is not an ideal drug. So first one, it was used as a Procaine, but it is practically not used because of many problems which are associated with the Procaine. But Procaine, its amide derivative that we have seen in last lecture, it is become a procainamide that can be used as a very good anti-arrhythmic drug. So it is generally given through the systemic route as a procainamide to reduce abnormal heart rate and force of contraction, that is called as the arrhythmia. So although the Procaine, it is the first synthetic local anesthetics, but practically it is not used. This point you must remember about the Procaine. Third drug we'll see, that is again unique drug, that is the lidocaine. It is also called as lignocaine. So don't get confused. Both drugs are same, lidocaine or it is called as the lignocaine. So the lignocaine, it is most widely used local anesthetic. Now let's see what is the reason why it is most widely used local anesthetics. Because it is a good surface and injection anesthetics. It can be given in the both the way to produce topical anesthesia or surface anesthesia, as well as regional anesthesia by using the injection. Okay, so it is a good as a surface and injection anesthetics. Injected around the nerve, it block conduction within 3 minutes. It means within 3 minutes it can stop sensation of the pain, and it has ability to produce local anesthesia. So for that reason, you need to give the injection of this drug, that is lidocaine, around the nerve, so that it can block that nerve to reduce their conduction within 3 minutes. So that is second advantage. Third advantage is that the anesthesia which is produced by lidocaine, it is very intense and it is a long lasting. So there is no need to give another injection of the local anesthetic. So once you give the injection of the lidocaine, and if you want, you know that if it is minor surgery, obviously local anesthetics are used in case of minor surgery. So if it is maybe for 10 to 15 minutes also, then it can be it can produce their action till that particular time, because the lidocaine having intense and long lasting action. So these are the advantage, and that is the reason why it is most widely used local anesthetics. Let's see what are the problem with this drug and what could be the adverse effect. So if the drug goes into systemic circulation and if it reaches to the brain, then it may produces the drowsiness, then mental clouding. It also alters the taste and it may produces the rhinitis. Okay. So what is rhinitis? Rhinitis, it is inflammation, especially in the nasal cavity. So if there is inflammation in nasal cavity, it is called as rhinitis. So it is seen especially in case of viral infection, or it may seen in case of the allergic patient, the patient who is allergic to maybe the dust, or in those cases, if it's come in contact with that, the mucous membrane of the nasal cavity, it's inflamed. So that is called as the it is ending with the taste. So that indicates it is the inflammation. Okay, and due to that, patient may suffer from the sneezing and the runny nose as a very common symptom related to rhinitis. So there is altered taste and the rhinitis. It is also one of the problem with the lidocaine. Let's see what happens in case of overdose. So if there is inadvertently overdose of lidocaine, if it is being given, then it may produces the problem related to muscle twitching. It produces a cardiac arrhythmia, that is very uncommon symptom. Then it produces fall in the blood pressure, and lastly it produces respiratory arrest like other local anesthetics. So these are the symptoms we already seen as one of the adverse effect of the local anesthetics, and lignocaine or lidocaine, it is not exceptional to this. Okay, so it is a popular anti-arrhythmic drug, very good anti-arrhythmic drug as a lignocaine. Okay, so these are the uses. Although it is popular anti-arrhythmic drug, but mostly it is used for its local anesthetic action. Now lastly, we'll see about method of administration of the local anesthetics. how local anesthetics are given, and what are the different means and ways which is by which you can give local anesthetic, so that the particular anesthesia which is desired by the surgeon or the person who is operating on the patient or is doing minor surgery can have that proper local anesthesia. Okay, so the first, it is the surface anesthesia, and name itself indicate that in case of surface anesthesia, simply what you are doing, there is direct application of the drug on the surface such as the skin and the wound. So on the skin or the wound you are applying the anesthetic agent, so there is no pain, and if the wound it is the bigger, so you can do the stitching as well. So this is simply by using the cream or the ointment of the anesthetic drug. So that is called as surface anesthesia. Second one, it is infiltration anesthesia. So in infiltration anesthesia, you are giving injection of local anesthetic, especially in the subcutaneous tissue. So there are different layer in the skin. So one of the especially the second layer, that is first one, it is the cutaneous, and below cutaneous layer the layer of the skin is present, it is called as subcutaneous layer. So you are giving injection of local anesthetics in subcutaneous tissue. So when you give this injection, so subcutaneous tissue, generally many nerve endings are present. Since you are given the injection of local anesthetics in subcutaneous tissue, those nerve ending will block, and it may paralyze the nerve ending at the site of action. So if you want to give this very short incision by using the scissor at particular area or in very small area, right? There you can use infiltration anesthesia. Third thing, in case of the nerve block, where the local anesthetics is injected in the vicinity of the major nerve such as the teeth. Suppose if you want to have the teeth extraction, if you want to remove the teeth, okay, so that is painful process. So simply in the root of the teeth you can give the injection where major nerves are present. So although you extract the teeth, that message will not convey to the brain and patient will not suffering from the pain. Okay, so there is complete loss of pain sensation in that particular area. So where in case it is used generally in case of dental surgery or for the dental purpose, so you are giving injection in the vicinity of the major nerve. So this is the third way of administration of the local anesthetic. Fourth way, you can give the injection in the epidural space. Okay, so it can be generally used in case of epidural anesthesia. So where you are giving simply the injection into the epidural space. So here in this figure you can see the epidural space. It is the space which is present between a dura mater and especially the wall of the cartilage. So these are your cartilage or vertebra. Okay, and in this vertebra, the space between this vertebral wall and the dura mater. So this is the dura mater. So that is called as this red part that you see. It is nothing but your epidural space. So you are giving injection in the epidural space so that it can produces very good anesthesia. So especially after giving this injection, and if you want to operate this or if you want to do a small procedure which is related to back surgery or related to the spinal cord, okay, then it can be nicely used. Okay, so this is the fourth method. Fifth method, where you are giving injection into sympathetic nerve. So sympathetic nerve, it is specially present in between thoracic and lumbar vertebra. So if you block this sympathetic nerve, then it can reduces the problem which happen due to stimulation of cardiovascular system, because sympathetic nerve, it control your sympathetic stimulation, and the stimulation of sympathetic system lead to increase in the heart rate and the force of contraction. So you can give sympathetic, you can do sympathetic block, and you can have the minor procedure in that particular area, okay, of the sympathetic nerve. Then you can use spinal anesthesia, where simply the injection of local anesthetic, it is given into the subarachnoidal space in the lumbar region. So you are giving the injection in the lumbar region, and that is specifically the injection it is giving you are giving in the subarachnoidal space, that is the dura mater. It is there, so in that dura mater and the spinal cord, so that space you are giving the injection, that is called as the subarachnoidal space. So you can just Google out and you see the image of the subarachnoidal space where it is exactly located. So there exactly you are giving the injection of the local anesthetics. So these are the different method of administration of the local anesthetics. Lastly, we'll see about the uses of local anesthetics. So I am going to just enlist the uses. So first one, it is topical anesthesia. It can be possible by using the cream and ointment. So in case of very small procedure or very minor procedure, you can use topical anesthesia. Secondly, is that is the peripheral nerve block. So in case of the major nerve block like the teeth extraction, so there you are giving the injection in the nerve, in the vicinity of the nerve, so that there is complete nerve block and there is no pain. Okay. You can also give intravenous regional anesthesia, where at particular region, if you want to reach your anesthetic agent, then that can also be possible by using intravenous regional anesthesia. But it is risky because drug, it is going into systemic circulation, it may expose to the brain, it may expose to the heart, and it may produce a different adverse effect that we have seen in our first part of today's session. Okay. So intravenous regional anesthesia, it can be used for spinal and epidural anesthesia. So these are the different procedures which are selected based on the patient condition or based on what type of minor procedure you are doing with the patient. And lastly, it is used as a systemic drug. Its use, it is limited as the antiarrhythmic drug or treatment of the pain syndrome. Suppose if you are suffering from very severe cancer, then cancer pain, it is intolerable. If it is not controlled even by giving the morphine, very strong analgesic drug like morphine, then in that case you can think of blocking the nerve which carries the pain sensation. So that is the last choice in case of the cancer pain. So treatment of the pain syndrome can be given, and some and local anesthetic like lidocaine and procainamide, it is also used as anti-arrhythmic drug. So these are the different uses of the local anesthetics. So I have done with this today's session, and our local anesthetic chapter, it is over. So I have referred this textbook, K.D. Tripathi, Essential of Medical Pharmacology, 6th edition. I must thanks to the author of this textbook for providing wonderful information on this topic. Thanks for watching my session. For more such learning, subscribe to my channel. And if you like my session, then do remember to give me a thumbs up. So give me some time. I will be releasing attendance and feedback link in the chat box. Yes, attendance and feedback link has been released in the chat box. So you are requested to give the attendance